I'm Bill Schmelzer. In January of 2016, so almost 10 years ago, I became a post-op surgical site infection statistic. I did volunteer for that surgery. I did not volunteer for this permanent infection. In the fall of 2015, it became obvious to me I had to do something about my hips. My left one was killing me, my right one wasn't much better. Preoperatively, my CBC was all within normal ranges. I had no comorbidities. Other than chronologically, I was 64 years of age. The surgery itself went fine. On Monday evening, post-op day 4, there was some swelling in the extremity. And Tuesday morning, I popped a fever of 101. 24 hours later, by Wednesday evening, the swelling had increased, the fever had persisted, and what my wife noticed was a change in behavior. And by Sunday evening, my wife could, at times, she could barely understand what I was saying. It wasn't coming out as words or sentences. She slept out on the couch, she checked on me every hour on the hour, and we struggled through the night. The doorbell rang at 8 o'clock. It's the physical therapist. She took one look at me, turned to Teresa and said, "Call an ambulance." I was delirious, I was hallucinating. I was absolutely out of my mind. And when the doc did his setup and he put the needle into the hip, he pulled back on the syringe and he pulled it out and he held it up and it had about 1/3 of a barrel of fluid. And I said to him, "That doesn't look very good." It was very milky looking. And he said, "No, this doesn't look very good." Thursday morning, the hospitalist comes in. She says, "We have the results from the blood work we took. The diagnosis is septic bacteremia and MRSA." As soon as she left the room, I turned to my wife. I said I would like to see a priest as soon as possible, because I was in the surgical and infection prevention division of the corporation that I worked for, and I knew the numbers. The toughest moment in all of this was that evening. My kids arrived, and I pointed out to him that I wasn't sure what was going to happen. But the two most important days of my life were the day that each of them was born. 25 to 35% of all surgical site infections, the patient walks in the door with the bacteria that it causes the infection. I was negative for MRSA. The culture was negative. If it had been positive, the surgeon wouldn't have done the procedure. So then the question becomes, where did it come from? Because if it's not an endogenous source, if I'm not the source, then it's an exogenous source. It came from somewhere else. The cost of one serious infection far outweighs the cost of getting their lead cleaned, right? And I've worn them, right? I've been in cases where I've worn lead too. One time I remember very distinctly saying, "But it smells," right? It's filthy. I talked to my epidemiologist about this 2 weeks ago when I met with her. And I said, who cleans your lead throat protection and aprons? She didn't know. They need to recognize that nothing's really happening and that what they are doing, even if they're doing it, isn't really that effective. Something is carrying bacteria from one place to another. And I think lead is one of the options.